everyone. Welcome back. Ready to dive in. Today we're tackling something that I know can be a real headache for a lot of you out there.
Oh, yeah.
Managing those finances for clinical trials.
What a big one.
Huge. And we've got a great source today that really gets into the nitty-gritty of it all.
Absolutely.
So by the end of this deep dive, you're going to be walking away with a much better grasp on how to use scenario planning, not just to predict those costs, but to really get a handle on them.
Yeah, taking that reactive scramble
Oh, tell me about it.
and turning it into proactive strategy.
I love that.
Yeah.
Proactive strategy.
Proactive.
That's the key, right? And our source really nailed it with this whole idea.
Totally.
Predicting those financial hiccups makes for smoother sailing in the long run.
For sure.
So in the world of clinical trials, what makes that proactive approach so important?
Well, you got to think about the scale of these trials, right? You've got researchers pushing boundaries, regulations coming at you from every angle, stakeholders everywhere you look, and of course, at the heart of it all,
The patients.
the patients, exactly.
Waiting for those treatments.
Depending on these potential treatments,
There's a lot of pressure.
it is. It puts immense pressure on those budgets.
Yeah.
And unexpected costs, they can pop up just about anywhere.
Oh, I know it.
Supply chain issues, regulatory requirements, you name it.
It's like navigating a maze blindfolded, but the maze is made of spreadsheets.
Ooh, I like that.
Right.
That's a good one.
And every wrong turn you take costs you time and money.
And potentially lives, right.
Exactly. And the longer it takes to navigate that maze, the longer it takes to get those treatments out to the people who need them.
To the people who need them most.
And that's where I think this whole concept of scenario planning comes in.
Exactly.
So it's less about having a crystal ball and more about creating a roadmap.
With alternate routes.
I like that.
Yeah.
Alternate routes, being prepared for those detours. So how does this roadmap actually work in practice?
Think of it like this. You're using these predictive tools to kind of game out different what-if scenarios. Okay, so let's say you're planning a trial for a new oncology drug. You could use scenario planning to model a bunch of possibilities. What if patient recruitment in, say, a certain region is slower than we thought?
Right.
What if a competitor drug suddenly hits the market
Oh, wow.
and impacts enrollment?
Yeah.
You can actually use software now that incorporates all kinds of historical data and predictive algorithms to estimate the financial hit of each scenario.
So you're not just caught off guard. You can adjust your budget and your strategy in real time.
Exactly. And that's the beauty of scenario planning.
I see.
It's not just about avoiding the financial surprises.
Right.
It's about how those surprises can totally throw off a trial's timeline.
So fewer fires to put out keeps things moving forward.
Keeps things moving forward, yeah. When things move forward, smoothly, the data collection is more efficient, decisions happen faster.
Right.
And ultimately, those treatments get to patients faster.
That's amazing.
Think about it.
Yeah.
Proactive financial management can actually directly impact how quickly a life-saving therapy gets into the hands of the people who need it.
That's incredible.
It is.
It really underscores just how crucial planning like this is.
Oh, yeah.
But even with the best models and predictions, there's always a chance for the unexpected, right?
There is, absolutely.
You can't predict everything.
You can't predict everything.
But it's not to say that scenario planning is a waste of time.
No, not at all.
Right.
It's about minimizing the blow of those surprises.
I see.
When you've already thought through a bunch of what-ifs, you're not starting from scratch when something unexpected happens.
You have a framework.
You've got that framework in place.
You're ready to go.
To respond quickly and effectively.
So the takeaway here is that, this proactive financial management, it's more than just numbers on a spreadsheet.
It is.
Right. It's about setting up the whole trial.
The whole trial.
And ultimately, patient care.
Ultimately, patient care.
For success.
For success, yeah.
That's amazing. I love that.
Couldn't have said it better myself. And this concept, this scenario planning, thinking through those what-ifs, this is valuable for any complex project.
Oh, absolutely.
Not just clinical trials.
Not just clinical trials.
You're right.
Makes you wonder how much smoother other things could run if we applied that kind of forward thinking.
I know, right?
Well, on that note, thanks for joining us for another deep dive.
It was my pleasure.
Always great to chat with you.
Likewise.
We'll see you all next time.
See you next time.